Good afternoon, everyone. Welcome to today's San Bernardino County Medical Society webinar, Kids and COVID, Child Vaccinations, and Cultural Healthcare Equity for Families. I'm Janice Solorio, the Physician Relations and Marketing Manager for the Medical Society, and we're incredibly excited to host the second in a series of webinars made possible through a grant from the San Bernardino County Department of Public Health to provide COVID-19 vaccine equity throughout our region. We are pleased to be partnering today with This Is Our Shot and Vaccinate, who are part of our presentation and discussion today. A couple of quick notes. Please be kind as to keep yourself on mute. And if you have any questions, we are going to do a Q&A after the presentation. And we ask that you put your questions in the chat feature, or if you would like to raise your hand to make it more interactive during that session, then we'll go ahead and do that. And Soteria of our staff, our membership director, will be relaying the questions through the chat or calling on you to ask the question. Today's topic is incredibly timely, and that's purely by accident, as just last week, the FDA granted emergency use authorization for 6 months and up to receive the Moderna and Pfizer vaccines. This is a huge step for our public health to protect children from serious illness and death from COVID. Now opening the gateway for kids 5 and under to receive COVID vaccinations. And of course, we know COVID vaccine equity is when all people who are eligible, including children, have fair access to COVID-19 vaccination. We are extremely honored to welcome a true expert in this field, Dr. Erick Ball, a primary care physician at Southern Orange County Pediatric Associates, a member of the CHOC Primary Care Network. Dr. Ball is the District Vice Chairperson of the American Academy of Pediatrics in California, and also serves on the boards of the Orange County Medical Association and the California Immunization Coalition. He is a delegate to the California Medical Association House of Delegates and sits on the National Advisory Council of This Is Our Shot and Vaccinate. His interests include immunization, policy, legislative advocacy, childhood nutrition, and trauma-informed care. Dr. Ball received his undergraduate degree at Duke University, attended medical school at the University of North Carolina at Chapel Hill, and trained in pediatrics at Stanford University, where he also served as chief residence. Welcome, Dr. Ball. The floor is all yours.
Thanks so much, Denise. Thanks for having me. I appreciate the time. This is a very important topic. And as Denise said, it's very timely given what's going on right now. I'm going to attempt to share my screen. Awesome. Perfect. All right. So that's me. I wanted to thank, before we start, This Is Our Shot and Vaccinate. So this is a group that hopefully you guys are somewhat familiar with, and if you're not, I'll make you familiar with us. We are a grassroots organization of healthcare providers. It was organized in late 2020 to try to counteract misinformation online and to try to get good scientific information about COVID vaccines out to the public. Your very own Javier Sanchez was one of the founders of This Is Our Shot. And we do this through two aspects. So one is we do a lot of things online and try to put out positive messages about vaccines and combat misinformation online. And then we do things like this. So we do trainings, and the trainings are trying to get people to learn effective, non-confrontational ways to speak to patients and families about COVID vaccines and how to answer their questions in the most effective way possible. So thank you to This Is Our Shot and Vaccinate. And again, check us out online. I'll show you at the end. So what we're going to try to do today is give a little bit of updates on COVID-19. I'm a pediatrician, so I'm going to have kind of a slant towards children. I'll just warn you about that, but that's very much in the milieu right now with pediatric vaccines for under 5s just coming out. We'll talk about some key messaging that we use to have common concerns that families have about pediatric COVID vaccines. And then we'll talk about some effective communication tools of how to speak to families or patients about vaccination in general and COVID vaccines in particular. So this is our shot. Our vision is to be the nation's premier digital grassroots coalition of health heroes by providing accurate health information, promoting effective health policy, and building trust in science. And our mission is to build healthier communities by elevating the trust and voice of health heroes. You are all health heroes to me for being on this call, and I hope that that some of you will get involved more with our efforts after we're done today. So let's talk a little bit first about where we are with COVID. This is the most recent graph that I found, which started from last week about COVID cases in the US. And I think the things I want you to take home with this graph is, number one, we obviously had this huge Omicron wave in the beginning of the year that we all know about. But right now, if you notice, we're kind of at this plateau level where we're seeing a lot of cases. And I would argue that these cases are vastly underreported. I'll give you an example. My son had COVID about 2 months ago. We did a home test, never got reported. We never went to the doctor. He had very mild symptoms. He's had 3 vaccines. So that's not in this data. And so I think part of this reflects the underreporting of Omicron, given the fact that there's a lot of home tests and asymptomatic cases and what have you. But I would argue that as someone who's a full-time practicing pediatrician, and for those of you who are in clinical practice, we are seeing a lot of COVID right now. And we are certainly seeing not as much as we did at the beginning of the year, but I would argue that we're seeing more than what you see in this slide. So probably for every person who's registered here, there's probably 10 who are not. This is what we are seeing locally at my institution at CHOC, at the Children's Hospital of Orange County. So this is just basically year to date, so in 2022, so essentially reflecting Omicron, that we've had 314 patients hospitalized. I want you to note that 193 of them were under 5 years old. And in the ICU, 24 out of 47, so 50%, more than 50% were under 5. So part of this is because they haven't had access to vaccines prior to this week. But also, I want you to take away that these little kids can get quite sick with COVID. And I think the talking point that COVID doesn't affect kids is not true. And we see a lot of very sick kids. We see kids die. We certainly see kids in the hospital. And you can see on the graph to the right, that huge bump we had at CHOC and everywhere during the Omicron wave. And we're kind of at this steady state right now where we're just seeing a bunch of kids in the hospital kind of all the time. And again, the majority are under 5. This is data from the CDC. This is from the country. And so looking at, these are cases in the red, and just to show you the effect of vaccination, right? So this is adults, this is everyone. I'm sorry, this is from California. This is from CDPH, California Department of Public Health. So during the most recent little Omicron wave in late May, early June, you were 5 times more likely to get COVID if you were unvaccinated, right? So a big talking point of people who don't want to vaccinate is that the vaccine doesn't prevent you from getting COVID, it just prevents you from getting very sick with COVID. But this shows that it prevents you from getting COVID to a large degree, orders of magnitude. And it's even more likely to prevent you from getting sick or dying or getting hospitalized. So in that same time period in California, 8.3 times, you were 8.3 times more likely to be hospitalized with COVID-19 if you were unvaccinated. And you're 8.3 times more likely to die from COVID if you're unvaccinated. And then this is, I pulled this off the Orange County, because that's my county dashboard this morning. And this is pretty crazy. So in Orange County, California right now, there has not been a fully vaccinated patient in the hospital in Orange County since late May. So every single person in the hospital in June, in the entirety of Orange County, which is like, it's about 5 admissions a day-ish, so you can see on the bottom right corner, 100% of them are unvaccinated. So we're essentially getting to the point where this is a vaccine preventable disease. And with very rare exception, the people who get hospitalized or die of COVID are unvaccinated. And in the entirety of COVID in Orange County, 87% of ICU admissions and 83% of hospitalizations were unvaccinated. So this goes for adults, this goes for kids. Obviously, I probably don't need to teach this group, but vaccines really do make a humongous difference in who gets very sick, who dies, who gets hospitalized with COVID. Let's move on and talk about kids, because that's what I do. So these are confirmed cases and deaths of children in California. And the thing I want you to take away is that if you look at the rates in California, 54% are in the Latino population, but they make up 48% of the state population. Whereas multiracial groups make up like 14% of the cases. And so what you can take away from this is that the cases in California, at least in children of COVID, are not equally distributed, and they do not equal the percent California population. You are far more likely to get COVID, to die of COVID, if you are Black or Latino versus if you are especially Asian or white. And we'll talk a little bit about how the inequities in vaccine distribution and uptake has probably led to some of this. But just know that you need to kind of keep this in mind when you are counseling families about vaccinations, that certain groups are definitely at higher risk for morbidity and mortality from COVID. Here is COVID vaccines in the country. And I want you to see that this is pretty disappointing. So for children, we've been vaccinating 12 to 17-year-olds, so teenagers, since I believe May of 2021. So over a year, and only less than 60% are fully vaccinated in the country. And of our 5 to 11-year-olds, which we've been vaccinating since November, so 8 months, only 29% are fully vaccinated. Like truly abysmal numbers, considering that these have been out for so long. These are national numbers, but the California rates are similar, and our local rates are maybe a tiny bit higher than this, but are definitely similar. And I think there's a lot of reasons for this, and we'll talk a little bit about it, but I think there's a perception that COVID is not bad or dangerous in this age. And there's a perception that the vaccines have a lot of side effects and can be dangerous in this age. And taken into account those two things, a lot of parents have chosen not to vaccinate their kid. And it's pretty appalling that 70% of our school-age children are not vaccinated. We recently started vaccinating our under 5 group, and I expect these numbers will probably be even lower in that group, unfortunately. And that's why we're doing this talk, is to arm you and to talk about ways that you can talk to these 70% of families to get them to protect their children. Because as we know, as we learned from the past bunch of slides, vaccines are by far the best way to keep kids, adults, everybody safe from getting hospitalized or getting sick with COVID. Then when we look at vaccines, the inequities in COVID vaccines are striking, and they go with all ages. But if you are a 5 to 11-year-old, there's about 2/3 chance you are vaccinated if you're Asian. And if you're Black, it's only 1 in 5. If you're Latino, it's 1 in 4. If you're white, it's like 1 in 3 as a kid. If you look at the Asian population, almost like you're close to 100% coverage, including all ages in the United States. Whereas in the Black or Latino population, we're basically at 50-50. And this is multifaceted. There's a lot of reasons for this. There is historical distrust of the medical establishment, which is well-founded. We have lack of access. It's not, especially these 0 to 5 kids who we're doing, like a lot of providers don't have that. You can't just walk into a CVS and get that vaccine, or you can't get paid for the time off you need to go get vaccinated. There's also a lot of misinformation in the community, which is why we have, this is our shot in vaccinate, which is to try to combat that. But we see that a lot of social media networks, Facebook, what have you, they do a much better job of policing their English language posts versus their, say, Spanish language posts. So I think misinformation can travel a little bit easier in languages other than English. And it's truly appalling that we have this in the United States, and we have this in California, that basically you can predict whether someone is vaccinated based on their age and their ethnicity. So we have to think about this as we take care of our families. Here's another way of putting it, and you can see from this graph on the right that these inequities get worse as you look at little children, right? So when you look at like the older people, the adults, I mean, there's still inequities, like the Asian population's at 87%, the Latino Black is around 72%, so definitely lower. But when you look at the 5 to 11, the Asian population at 60%, the Black population is at 22%. So we are doing a horrible job of getting access to our COVID vaccines to children in the country in general, and to certain populations of children specifically. I think we all need to do a better job of outreach and making these vaccines available. And those of us who are providers, making sure that we ask these questions about whether their kids are vaccinated and try to get people vaccines as quickly as we can. Because we know that these kids are going to be more at risk for getting sick or dying or getting hospitalized than their peers who are vaccinated. So as we discussed last Monday, we started vaccinating kids 5 and under. My practice started, we had our first clinic last Wednesday. There's been 2 vaccines which have been approved for kids who are 6 months and up, 6 months to 5 years. Pfizer goes from 6 months to a 5th birthday. Moderna goes from 6 months to your 6th birthday. The Pfizer vaccine is a 3-shot series. It's 3 doses of basically 1/10 of the adult dose of the vaccine. And the studies show that, the outcome of what the studies look for was basically to make sure that the kids had equal or better antibodies to the teenagers and adults who we've been vaccinating for years now. And both the Pfizer and Moderna vaccines were shown in these trials to have good immune responses. So we can extrapolate that their protection should be similar to what we've seen for adults and teenagers. The Pfizer vaccine was shown to be 80% effective at preventing COVID-19. This was in a very small sample size. There were only 10 cases in the entire trial when they looked at this. So that's not really significant, but because their antibody levels were high, we expect that this should bear fruit. Moderna is a 2-shot protocol given over 4 weeks. The dose is 1/4 of the adult dose, so 25 micrograms. And it was shown to be about 40% effective at preventing milder illnesses, which is pretty much what we're seeing with the COVID-19 vaccine for all people in the time of Omicron. So essentially what we're seeing now in our clinics and in the community is if you've been vaccinated, especially if you're fully vaccinated or boosted, with the COVID-19 vaccine, your chance of dying or being hospitalized with COVID is infinitely small. It's vanishingly tiny. And I know this from personal experience. When my son, as I mentioned, like 2 months ago, got COVID, he's had 3 vaccines. We had 0 concerns that he was going to get very sick. And true to form, he had like the sniffles and he felt a little crummy for a day, and then he was better and just bored in his room on his computer. But I never worried that he was going to be in the hospital. Whereas every day I came home from work before vaccines were out, I was petrified that I would get COVID from my patients and pass it to my family. And definitely the amount of relief I have for my own children being vaccinated is something I talk about with my patients all the time. As you know, getting a COVID vaccine isn't great. It's not perfect for keeping you from getting COVID at all. And people like my son still can get COVID, but they generally get very mild symptoms. And we expect this is what we will see with these under 5 vaccines, is that it probably won't prevent them from getting COVID at all, but will make them less likely to get it, less likely to spread it, and ideally less likely to be hospitalized. So I'm going to shift gears a little bit. So I hope that I was able to get across the fact that COVID is real. It's still out there. We're still seeing a lot of cases. People are still being hospitalized and dying from it, but largely this has become vaccine preventable. And so I'm going to talk now about how we can talk to our families, our 70% of patients who are not vaccinated, to try to encourage them to get vaccinated. And when you look at studies of why people get vaccinated or do, follow these guidelines, their most trusted source is their physician, right? So is their pediatrician for kids. And so I'm honored that families come to me with these tough decisions, right? They hear a lot of things on social media and from their friends, and they very routinely just ask my opinion. And some just want to say like, hey, I just want to make sure that you think I should do this, right? And I'll be like, yeah, of course you should get your kid vaccinated. And that's it. And that's the conversation, and they get vaccinated. And sometimes we have a very long conversation and we try to debunk things. And I'll talk a little bit about that. But just know that as healthcare providers, we are the most trusted source of information about COVID-19 vaccines. We have this superpower, and it's important that we ask the questions about COVID vaccines and that we talk to our families about it, and we get kids and adults vaccinated as soon as we can. So I'm going to talk briefly about the conversation methodology that we talk about at This Is Our Shot in Vaccinate, about how to approach these conversations with families. And we call this the 353 method, and it goes like this. So there's 3 steps to starting the conversation. There's 5 key messages you want to get across, and there's 3 post-conversation steps. So these are, this is a methodology that we use to talk about COVID-19 vaccines, but you can use this in any other avenue of what you want to talk about with patients, about stopping smoking or to get my kids to go to bed in time or eat their vegetables. It's basically motivational interviewing. And I'm going to go through it with you step by step and how I use this in my office and how I hope you can use these methods in your offices and your clinical practices. So 3 steps to start the conversation. So the first, which is probably the most important thing, and this is going to be kind of your decision point about how the rest of the conversation will go, is to ask and listen to the answer. So asking is really important. I see 25 kids a day in my office. So using the data I gave you before, probably 20 of them are unvaccinated. And I ask, or I try to ask, every single one of them about their vaccine status. So I check my chart and I see whether they've had a COVID vaccine. If I don't see it, I'll say something to them like, hey, I noticed that like Jimmy isn't vaccinated against the COVID-19 vaccine. Do you want to talk about that? Like, is there a reason you haven't done it yet? Why do you feel that way? And so I kind of get a lay of the land and I try to feel out where they are and then how we can move forward with this conversation. The other thing is, if you don't ask, then you will never have this conversation. And I've had a lot of people who have just been putting it off and they've been waiting. I don't know what they've been waiting for, but it turns out if you're the one to ask, that's what they've been waiting for. And sometimes me just putting that bug in her ear help them to make the decision to vaccinate their kids. So make sure you ask, have you been vaccinated or something like that? And then listen to the answer. Sometimes the answer is something that's like crazy, like, oh my God, I wouldn't vaccinate my kid at all. Like that's Bill Gates trying to microchip me. Or sometimes I literally will walk in the room and before I talk about the kid's cough or whatever they're there for, the family will say to me like immediately, like, I'm not gonna get my kid vaccinated against COVID. I don't even want to talk about it, right? And I'm not gonna waste my time and my breath. I have 25 other patients to see and it's not worth sitting there for 30 minutes and arguing with a family like that, right? If they're pretty set in their ways, all I will do at that point is I will give them 1 or 2 sentences and I'll say, well, let me just tell you why I vaccinated my children and then we'll move on, right? And I'll give like a 1 or 2 sentence statement about how, as a pediatrician, unfortunately, I've seen a lot of patients with COVID. I've hospitalized kids with COVID. I've seen kids get very sick and put in the ICU with COVID. And there's a vaccine that's extremely safe and effective in preventing the complications of COVID. And I chose to get that vaccine for my children because it was very safe and effective and getting COVID is not, and I did not want them to get COVID. And that's it, and that's all I do. And then I move on and ask about their cough or their rash or continue with their well child check. But if they're pretty hardcore against getting their kid a vaccine, I usually don't even kind of go down that road at that point. Now, what's more common is a family will ask me questions or say something like, oh yeah, we've just been putting it off, or we haven't had the time, or we've been waiting to see some other kids to get it first, or yeah, I read some scary stuff on the internet about it. And that kind of opens the door to the next step in our conversation, which is to create an alignment of safety. So I would say, oh my God, like I'd be super scared too if I saw, on Facebook that the COVID vaccine would make my daughter infertile. And I want to do what's safe and best for her. Let's talk about that and then move on. So you want to create an alignment of safety. You don't want to ridicule someone for believing some crazy stuff on the internet or what have you. You want to acknowledge their agency and acknowledge the fact that this truly is scary and confusing for folks. It's scary and confusing for medical people. And if you're a non-medical person, with COVID at least, you're getting bombarded by lots of information, both true and false, online and with friends. And so you want to kind of create that alignment and be on the same page with them. And then you move to finding common goals. Like, why did I get my kids vaccinated? If you think about it, like each one of us should think, like, why did you get vaccinated? Like, why did you vaccinate your children? Like, I mean, I can list like 10 reasons why I got vaccinated. Number one was I don't want to die. Like, I don't want to get COVID and get super sick or get long COVID or something like that. But I have a lot of other reasons. Like, I don't want to get even a mild case of COVID and spread it to my vulnerable patients. And I don't want to risk my immunocompromised wife or my children from getting COVID from me. So there's a lot of reasons, but some people have other reasons. I have a friend who we were able to get her son vaccinated because he wanted to go on a trip to Iceland, and Iceland was requiring you had a COVID vaccine. Like, they really didn't want to vaccinate their kid, but he really wanted to go to Iceland. And that was their common goal. And we used that to kind of talk about COVID vaccines and why it was safe and how this would be an avenue for him to be able to travel. We have other people who get vaccinated to protect their family members. But a lot of people just want to protect themselves. And I hate to say it, but we live in kind of a selfish world. And I usually try to focus more on that. It's like, I want your child to be protected. I want them to not get sick of COVID. I want them to not get long COVID or other things like that. But you have to kind of dig a little bit and find the common goal. Like, what's your why? Why will this person get vaccinated? So you've now kind of set the stage, right? You have this non-confrontational conversation moving with the family, and now you can kind of dig deeper into their concerns. And I'm going to talk kind of generally, and then I'll kind of delve deeper into some common pediatric stuff. So our first key message, which we always talk about, is the vaccine will keep you safe, right? So this is like the most important thing that we can do to keep you from getting hospitalized or dying of COVID. It's been shown to reduce risk of long COVID. It's been shown to reduce risk of MIS-C, which is like the #1 killer of kids with COVID. And we've been doing this for almost 2 years now. I got my vaccine in November of 2020, and about 500 million vaccinations have been given in the country already. And so that's why we're seeing this disconnect, where we're seeing a lot of people still get COVID, but not that many people dying. It's because these vaccines are keeping people safe, and frankly, miraculously are keeping people safe. The next thing I talk about is that side effects are common and normal. I don't lie to people. I want to make sure that they know, like, hey, some people feel a little crummy the next day. You might have body aches. You might have a fever. You might feel a little tired or have a headache. Like, I'm very open and honest with it. What I don't do is talk about like fake side effects and things that people have read online about things that are not true. And I try to avoid going down those rabbit holes. And we'll talk about some talking points for those things. But I talk about normal side effects. Number 3, and this has been really important right now with the pediatric vaccines because it's very confusing, is the best vaccine is the one you can get today. For under 5, there's 2 choices of vaccines. You can get a Pfizer vaccine or a Moderna vaccine. For adults, you can get Pfizer vaccine, you get Moderna. There's some other ones. There used to be J&J on the market. Some people are waiting because they think, well, there'll be a new variant specific vaccine that might come out at some point. We have a lot of families who we're actively giving kids boosters now, 5 to 11-year-olds. And a lot of families are like, well, I want to kind of maximize their chances of not getting sick at school. So I'm going to wait until like August to give them the booster now. Any day you wait to give your kid a vaccine is just another day where they could potentially get sick with COVID. So it is best to just get the vaccine when it's available. Do it now. Don't be super picky about it. If your doctor is offering the Pfizer vaccine for your 6-month-old, get the Pfizer vaccine. If your doctor's offering the Moderna vaccine, do that. It's better not to be picky. All these vaccines have been shown to be very effective in increasing your antibody loads, keeping you safe. So just do what you can get. Number 4 key message is that this vaccine is built on years, decades of research and science. So this is not like COVID came out and then like they put together some concoction and we had a new vaccine within 6 months. This is technology that's been worked on for a really long time. As most of you know, in Asia, they were dealing with a SARS outbreak a decade ago, and a lot of these vaccines were worked on for that specifically, and then it was kind of shifted towards COVID and towards SARS-CoV-2. But this is not new technology. These are the first mRNA vaccines that have been on the market, but they will not be the last ones. And again, they've been shown to be extremely safe after almost 2 years of use now. And then the 5th key message is throw me your questions, right? So I am always honored and appreciative that my patients have questions for me. They come to me rather than Google to find out their answers to their questions. So we'll talk a little bit about those specific questions in a few. And then we go to 3 steps for post-conversation. The first step that we talk about post-conversation is acknowledge their agency and personal choice. Super important. If you're going to take home one thing from today, it should be that the goal of a conversation about vaccines or stopping smoking or losing weight or anything like that, the goal of that conversation is not that they get vaccinated that day, right? In most of these conversations, the patient is not going to get vaccinated that day. They want to go home and think about it. They want to talk to their, their spouse, what have you. So acknowledge their agency and their personal choice. You want to have that conversation. And I've had many, many, many situations when a family will come back to me the next day or a week later or a month later, and they'll say, hey, you remember we had that talk at like Jimmy's 7-year-old checkup about COVID vaccine? Well, we've been thinking about it and I think we want to do it now, right? And so we started that conversation like 6 months ago, but it's finally coming to fruition and they've kind of had their time to think about it. But what's really important is you're not a salesman. Don't give them the hard sell. You don't need them to get vaccinated right away. It's great if they do while they're there, but that's not the point of these conversations. The point of these conversations is to answer questions, is to build an alignment, and to make sure that you are with this family moving forward and accessible to them, which brings us to our next post conversation, which is keep the lines of communication open. I'll bring this up at future visits. Like the kid will come back a month later with a rash and be like, hey, remember we talked about COVID vaccine? Like, any news on that? Like, what have you thought about? Did you have a chance to talk to your spouse about the COVID vaccine? So we kind of keep following up on this and seeing if we can get a little bit further down the road. I'll sometimes even send like follow-up emails through my patient portal to patients to see if they've had any change of thought or, did you have a chance to get vaccinated? And the final step post-conversation is help them find a vaccine. I've been doing this a lot this past week with the under 5 vaccine. Unfortunately, and I'll put a plug in for the California Department of Public Health, less than 50% of Medi-Cal providers in California are offering COVID vaccines to their patients. And for children 5 and under, they really have nowhere to go other than their primary care provider, right? So their pediatrician or their family practice doc. And a lot of them aren't offering the vaccine and they have nowhere else to go. So I've been talking to people who aren't my patients who are going to come to my practice to get vaccinated, but it's hard. I've had patients who want, they want to come in on a weekend or a night. If you have a working family and the parents are working, it's hard to come in to get your kid vaccinated at like 11 a.m. on a Tuesday. And so it's important to try to help these families find vaccines for their kids. Navigating our healthcare system is atrocious, as you all know. And even for us, it's really hard, but we have an ability to be able to make phone calls and to navigate, the CVS website and things better than most of our families do. And so it's worth taking 2 minutes and helping a family try to find a vaccine if they can't find it on their own. So keep that open with your families. So again, just to rehash this, our conversation method 353. So 3 steps to starting the conversation, kind of get a lay of the land, create an alignment of safety, 5 key messages that we talked about, and then 3 post-conversation steps. Again, not necessarily getting vaccinated, but making sure that you leave the lines of communication open and you help the families moving forward. So as a pediatrician, let's talk a little bit briefly about some common concerns that parents have. These are some of these questions that we often get. My number one question is that COVID-19 does not affect children. I hope I've dispelled that to some degree today. As you guys know, millions of children have had COVID-19. 119,000 have been hospitalized, and we're over 1,000 who have died. The big thing that we worry about is this thing called multisystem inflammatory syndrome, or MIS-C, which happens usually around a month after a COVID-19 a COVID-19 infection. And after COVID-19 infection, you basically get this huge inflammatory response in a kid, and it often shuts down organs, and especially the heart, and can be pretty devastating. I've had several kids in the ICU because of this, and it's super scary. And the vaccine has been shown to be very effective at preventing MIS-C, over 90% effective. So it's by far the best way to protect our kids. But kids certainly get COVID-19, and even the kids who get mild cases, they still get pretty sick. And it's really sad to see kids who have fevers and body aches and feel kind of crappy. And even in the best case scenario, they miss like a week of school. If you can prevent all that from getting vaccinated, it's worth doing. lot of people worried that the COVID-19 vaccine is not effective. I hopefully have shown you with lots of data that it is extremely effective, especially at preventing illness and hospitalization. And it's really, really, really important to kind of drive this home. And this has been kind of the theory with our flu vaccines as well, right? So as we all know, the flu vaccine is not like the best at preventing you from getting the flu. I have lots of patients who get flu vaccines who still get influenza, but they get way less sicker than the kids and the patients who do not get vaccinated, and they recover way faster. And the COVID-19 vaccine is similar. It really reduces the risk of hospitalization and death. As I showed you in Orange County, there have been 0 unvaccinated people in the hospital in the month of June. Every single person who's been hospitalized has been unvaccinated. So the vaccine is super effective at keeping people safe from COVID-19. There's a lot of concerns about the COVID-19 vaccine not being safe. This is obviously not true. The vaccine is like extremely safe. Like 2/3 of Americans are fully vaccinated, and we've had over 200 million people who have received the vaccine and are protected. The line that I sometimes tell my families is that the COVID vaccine is safe, but COVID is not. And I think we're in this situation now in the world that there's going to be basically kind of 3 pools of people moving forward, and which we're seeing now. There's going to be vaccinated people like me who get vaccinated for whatever reason, like I never got COVID, right? So vaccinated people who never get COVID, vaccinated people who get COVID, but generally get very mildly sick with COVID, and then unvaccinated people. And when you take those 3 groups, the unvaccinated group is at way higher risk for getting really, really sick. And so the vaccine is way safer than the disease itself. And that goes for kids as well. Obviously, there's been a lot of concern about myocarditis with the COVID-19 vaccine. And I'm not going to lie, there's been cases of the COVID-19 vaccine causing myocarditis. It's been about a risk of 1 in 20,000 all told in the most highly affected groups, which are teenage boys to young adult boys. It's been somewhere in the 1 to 20 to 1 to 30,000 range, like really, really small. I've never seen one. I don't think we've had one in our practice, but it is a rare side effect of the COVID-19 vaccine. What I try to talk to my patients about is that COVID-19 virus, the infection, has a much higher rate of myocarditis. So all those patients that we've seen with MIS-C is like myocarditis is part of MIS-C, it's inflammation of the heart. And then you get isolated myocarditis as well. So if you want to avoid myocarditis in your child, the best thing you could do is to get vaccinated, because if you don't get vaccinated, they're probably going to get COVID-19. And of those people who get COVID-19, some of them are going to get myocarditis. So the safest way to prevent myocarditis is to get your kid vaccinated. We have a lot of families talk about how the vaccine was rushed, right? That this has not been studied adequately, and I want to kind of wait and see how it kind of turns out. Well, those families have waited, right? Like we've been doing this for a really long time now. Like billions of vaccines have been given worldwide. 65% of the world's population has been vaccinated. Like that's a lot of data points that we have. That's a lot of long-term data points that we have. And if something bad was going to happen with the vaccine, we would have seen it. I mean, think about the Johnson & Johnson vaccine that was causing some blood clots when it first came out, right? I think it was an order of like 3 in a million or something. And we were able to see that data because we've given so many vaccines. So this is a vaccine that's been studied, it's been extensively given out, and by no means has been rushed. And when we look at the little kids, so the under 5 years old and the 5 to 11-year-old groups that have been recently vaccinated, those vaccines have been thoroughly studied as well, the same kind of studies that we do for all other vaccines. And we've actually seen fewer side effects in those groups, including almost no, like actually in the studies, no cases of myocarditis in those younger groups versus the older groups. A lot of people are like, well, I already got COVID, so like, I'm good, I don't need to get vaccinated, or I'd rather get COVID because I'll get better immunity from the disease. As we know, the disease does not give you very adequate or long-lasting immunity. It certainly is protective, but not very long. And Omicron in particular does not provide very good immunity. You get immune for like a month and then the levels of antibodies just kind of plummet. And when you get vaccinated, you get far superior, longer lasting immunity that we know, and it's much more predictable versus the immunity you're going to get from getting the COVID disease. I have lots of patients who are on their second or third round of COVID. They keep getting it. And every time you get it, you're playing Russian roulette with getting really sick or getting hospitalized. So it's much safer to get vaccinated versus, just getting COVID over and over again because it's not really protecting you that much. And then also we hear a lot of people worried about long-term side effects of vaccines. So there's never been a vaccine in the history of the world that causes long-term side effects. And by that, I mean like side effects that happen more than a few weeks after the vaccine dose. Like we don't see cases of like people's heads exploding 12 years after their tetanus shot. It just doesn't happen. There's no mechanism for it to happen. And so there's no reason to think this would happen with a COVID vaccine. And, 2 years into giving this vaccine, obviously we don't see any long-term side effects with the COVID vaccine. The issue which we do see is long COVID, right? So like there's a lot of people who get COVID who have lingering symptoms. And I have a lot of patients who have lingering lung issues, neurologic issues, heart issues after getting COVID. And I have 0 patients who have any long-term issues because of the vaccine. So if you're worried or your patients are worried about long-term side effects, like you should be really worried about getting COVID because your risk of long-term effects is way worse with the virus versus the vaccine. I think the gist of all of this is like, if you are worried about blank, the disease is way worse than the vaccine. The vaccine is always safer than the disease. You get all the protection with none of the risks. We hear so much about worries about vaccine causing infertility. This has been a really common anti-vaxxer trope that makes its way through social media. We saw this a ton with the HPV vaccine when it first came out. And it's a really good way to needle parents and to really make them scared because nothing would worry them more than like, oh my God, my kid's going to be damaged and won't have kids because of the COVID vaccine. 0 evidence. This is just not true, right? Like there's 0 reason to think this would be true. There's been lots of studies which have shown there's no differences in pregnancy rates and people are vaccinated versus non-vaccinated people. And in fact, it's now recommended through medical agencies that pregnant people get vaccinated against COVID because pregnancy is in itself a condition that makes you at higher risk for getting really sick with COVID, and getting vaccinated during your pregnancy will provide some protection to your baby once they are born. So we've been giving this vaccine for a year and a half to pregnant people. We had a lot of pregnant people in the initial trials that were shown to be safe. So this has been like thoroughly debunked, not even an issue. And then talking more about pregnant people. So, I've never been pregnant, but, pregnancy puts you at a lot of increased risk of hospitalization and puts you at increased risk of blood clotting and breathing issues and things like that. And then you get COVID on top of it, and it is a higher risk situation. And so it is really important that everybody, but people of childbearing age get vaccinated against COVID and in fact get vaccinated while they are pregnant, because again, that protection will pass through the placenta to the baby. It can be passed through breast milk to help the baby. And we see this, we actually see not a lot of like tiny little babies getting COVID. Like my highest rate of kids getting hospitalized are generally like 6-month-olds to 12-month-olds, those type of kids where that immunity is kind of wearing off. But we certainly strongly recommend that pregnant women get vaccinated to help with both themselves and their children. This is me in December 2020, getting my first vaccine, my first of 4 vaccines. Again, as I said, I have not yet had COVID. Thankfully, that's probably some good luck. It's probably because I wear a mask everywhere. It's probably because I got vaccinated a lot. But I hope I was able to show you guys today that getting vaccinated is, as you know, by far the best way to keep our children and families and patients safe from getting very sick or hospitalized with COVID-19. But it's a heavy lift. We have a lot of kids, especially who are not vaccinated. And then again, there are certain groups that are even more poorly vaccinated. And it's really important that we as a individual physicians and clinicians and as a community, like do some outreach, ask those questions, be accessible. And I'll leave with one final thing is that if you are a provider and you are not offering COVID-19 vaccines in your office, especially if you take care of children, I would implore you to please go to MyCalVac's website to get signed up through the California Department of Public Health. It's really easy to incorporate this into your workflow. I do this in my office. And just remember that a lot of these families have nowhere else to go or no one they trust as much as you. And so it's our job to make sure that these people are vaccinated. Thanks for what you do. If you guys are interested in talking to the community about COVID, if you're interested in our mission that This Is Our Shot, doing stuff online on social media or through training such as this, please take down this information. thisisourshot.info. You can follow me on Twitter and see pictures of my dogs mainly at Dr. Erick Ball, or feel free to drop me an email at eball@choc.org. And with that, I will end and take some questions.
Thank you so much, Dr. Ball. That was awesome and provided some great and valuable information for us all. We'd like to go ahead and open up things. And if any attendee has any questions, please feel free to put it in the chat feature or raise your hand, and Soteria can call on you to go ahead and ask that question for Dr. Ball.
Absolutely. We do have one question in the chat that, and it is actually from Janice. It says, will children also need a booster?
So yeah, so currently children, so we've been vaccinating kids, again, 12 to 17 since last May, and they've been offered boosters for quite some time. My 17-year-old had his booster in December, I believe, which was 5 months after his second shot. And then it's helpful that I have kids of these ages because I kind of remember when they got their vaccines because they both got it the first day they were available. My 14-year-old daughter also got her booster in December. The 5 to 11-year-old group, we started vaccinating just after Halloween. So in November, and then boosters are recommended after 5 months after your last shot. So we've been doing a lot of those boosters in our office right now. The little kids, it's too early to say, right? So like even the earliest ones have only had one vaccine. I would anticipate that probably they will need boosters down the road, but it's a little bit harder for kids because their immune systems are so robust. I mean, they just respond to these vaccines really, really well. And we see this with the kids, like these little kids who are in like we're giving a Moderna vaccine in my office, they're getting a quarter of the dose and they're getting the same antibody levels as I did with 100 micrograms versus 25 micrograms. So I don't know, we don't know. And then we don't know whether they're going to get variant specific, Omicron type boosters in the future. So I would bet that this will end up being something like a flu vaccine that we'll all get kind of periodically, but you never know.
Thank you.
And we do actually, the questions are coming in. Our next question is, hi, there was a published article on Internal Medicine Journal of a 51-year-old Asian female who developed T1D after COVID-19 vaccine. Is there also a case on pediatric population? Is there any? How can these cases be screened prior to vaccination?
So I haven't heard that case. As you guys probably know, because this has been kind of in the media, there has been actually an association with type 1 diabetes with COVID disease. So we definitely know that there's a link between probably the inflammation that COVID will cause in your body to increase risk of type 1 diabetes. So we definitely know that there's an association with getting COVID and getting type 1 diabetes. I'm not sure about this case. The hard thing is we vaccinated, 2/3 of the country, right? 200 million people have been vaccinated. Bad stuff happens to people every day. And some of those people would have had their COVID vaccines recently. And it's really hard to kind of tease out what caused what. We see this with, there was a big hubbub a long time ago, and we still see it a little bit in social media about like the MMR vaccine and autism. And, people noticed that like, hey, my 12-month-old wasn't talking and they got their MMR vaccine and then they continued to not talk. And, it's hard to tell, like, was that the MMR vaccine or is that just because that's when we start seeing the first signs of autism? And lots of studies have been out and show that it's just a correlation, like the MMR vaccine has nothing to do with autism. So, as an example, when you look at the data from the 0 to 5-year-old, there was a death in one of the groups. I forgot which one, but it was a kid who was in a car accident, right? But it goes in the thing, right? Like the kid who had a car accident like a week later or whatever. But obviously the vaccine had nothing to do with the car accident. The 2-year-old wasn't
Right.
driving the car or anything, but like it goes in the packet. And so I would guarantee there's been people who've developed type 1 diabetes shortly after getting the vaccine. There's people had heart attacks shortly getting of the vaccine. There might be people in car accidents or like falling off a ladder. But like the vaccine probably doesn't cause those things, because if it did, we would start seeing that as a pattern. And if we've given 200 million people vaccines and even like 0.1% of them were getting type 1 diabetes, we would start seeing that in the data.
Looks like you're muted yourself there, Eric. But on that end, for those of you, I'm Dr. Sanchez. I'm a family practice physician. And I just want to touch on that question, is that actually the COVID infection, we've seen a rise in people with possibly having type 2 diabetes, especially those that are pre-diabetic, not necessarily with the vaccine, but we are seeing a correlation in which those individuals that are controlled or maybe pre-diabetic may actually get out of control when they get the COVID infection, not the vaccine itself. We're still not sure why. We think it has to do more with the inflammatory changes that occurred because of the infection itself, but not necessarily due to anything else. And definitely we're not seeing that much of an issue with the vaccine itself.
Very good. Thank you. Next question. Is it recommended for children to receive COVID vaccine at the same time as routine vaccines, or what are the recommendations?
Yeah, so the vaccine is approved for co-administration, so it should be safe to give with other vaccines. We've been doing that for older kids, so for our 5 and up kids, we've been giving their vaccines at the same time. It's a little bit easier in that group because they don't get as many vaccines as often as the younger kids do, but it should be safe to co-administer.
Okay, thank you. Next question. Has herpes booster been documented as an uncommon side effect of COVID-19 vaccine?
I have not heard of this. Again, I'm a pediatrician, so we generally don't see herpes zoster anyway. I don't know. Javier, you might know better than me, but I have not heard of that.
No, this is, I have not actually. I'm going to look into it, but I have not seen that correlation at all.
Okay, great. Oh, wait, let me see. Is there another one? It says, we have seen a rise in rashes 2 weeks after either second COVID vaccine or after booster. Does not happen immediately, but 2 weeks later. Is this common?
Again, I don't think it is. I haven't heard of such a thing. Again, as a pediatrician, like, again, the kids' side effects tend to be a little bit milder than the adult side effects, so I haven't seen any of this kind of thing. It's not, so we see rashes and things 2 weeks after live virus vaccine. So for example, the MMR vaccine, the measles vaccine, or even the chickenpox vaccine, it takes a little while for your body to process it. So we tend to see side effects a week or two after the vaccine. In every other vaccine, we tend to see effects kind of right away. So like with the COVID vaccine, which is not a live virus vaccine, we tend to see most side effects like pretty much immediately, where you have a sore arm or you have a fever. It's like that day or the next day generally.
Great, thank you. Dr. Lane, you have a question? Oh, you have to unmute yourself.
Got it. Dr. Ball, great talk, great talk. Do you still wear a mask at the grocery store?
You know, it depends on what's going on in the community. I am now. But I see, you know, I play it. I've had 4 vaccines. I recently had a second booster, so I feel pretty comfortable about it. But my wife is immunocompromised, so I think I need to be a little more careful than the average person. I obviously wear a mask in the office. But I was taking flights 2 or 3 months ago, and I actually wasn't wearing a mask. If I took a flight tomorrow, I would, because I'm just seeing so many more people getting COVID now. I kind of use what we're seeing in what we're seeing in the office generally. The in Orange County right now, the positive rate is 17 or 18%. So if there's 100 people in the grocery store, there's a reasonable chance 1 or 2 of them have COVID. So I've been a little bit more careful recently.
Okay. I guess the answer should be yes.
Yeah, it should be yes. But I think it's yeah. I have personal reasons. Again, I'm a physician. I don't want to get my kids sick and stuff. So I have a lot of other reasons to do it. If I was some random single guy, 24 years old, living by myself, like I might be a little more cavalier about it.
Okay. Thank you.
Great, thank you. Next question is, currently there is a Dr. Claire Craig statement about how Pfizer twisted the 6 month through 5-year vaccine data circulating, and I'm hearing it from colleagues and patients. What do you think of that?
Don't know. I don't know who that is. I try to not click on those posts.
Right.
I mean, to be honest, like, right, like I am a physician, I'm a scientist. I know people who are on ACIP. I know people who are on the FDA committee. I know these are people who study data for a living and are infectious disease specialists. And I trust these people, and I trust them with my own children's safety to get vaccines and my own safety. And so I am not an internet conspiracy theorist, and I'm not going to be reading random posts. I'm going to trust the experts, which is I hope what our patients do.
Absolutely. And we have one more question. For kids under 5, Pfizer is done in 3 doses. Do you know the reasoning for Pfizer needing 3 and Moderna needing 2? Getting my 7-month-old vaccinated on Friday, and I haven't fully decided which one to go with.
I'm really glad you asked that question. I was going to talk about that briefly, but so I think when the companies came out with the dosing, I mean, basically they wanted to find a dose that was safe and effective for kids. And they know the kids were going to need a lesser dose. And Pfizer chose to use a dose that was 1/10 of the adult dose. And in their initial studies, when they gave 2 doses 3 weeks apart, the same as the adults, the antibody levels for the children, particularly the children 2 to 5 years of age, was not as high as it should have been. It theoretically would not have been at protective levels. It wasn't at the levels of adults. And honestly, they probably used too small of a dose because they wanted to make sure that the side effects weren't bad. You don't want to give kids fevers and things. So side effects were fine, but they weren't getting enough doses. So they added a 3rd dose 8 weeks later and got very effective levels with that. So smaller dose given over 3 doses, whereas Moderna gave a 25 microgram dose, which is a quarter of their adult dose versus a 10th. And they were able to see good antibody levels with just a 2-dose series. Now, so you get that and you think, well, I'm going to get the Moderna vaccine, right? Because it's 2 doses, I got the same bang for my buck. It's great. But what we know from at least the teenager and adult vaccinations is actually if you space out, one of the reasons boosters work is if you space out some of the doses, you actually tend to get higher antibody levels, which is why some countries are giving those, 1st and 2nd doses of, say, the Pfizer vaccine over like 8 weeks or 12 weeks versus the 3 weeks we do now. So we don't know yet because these are just out, but the Pfizer vaccine might give you a little bit longer lasting immunity because of that spread out dosing. And the kids who get Moderna might need a booster in the future. So again, it's kind of 6 of one, half dozen the other. I wouldn't be super picky about it. As a pediatric group, we just chose one to go with just for simplicity. And honestly, a big part of why we chose to give the Moderna was because it doesn't not need to be reconstituted. So you could just draw it up and give it rather than mixing it and then drawing it up. And it was just easier for our nurses to do that way. So again, key point number 3 is get the vaccine that you can get today.
Perfect. Well, it looks like our time is coming to an end, but before we do, and I do want to turn the floor over to Dr. Sanchez for a moment so that he could say a few words to Dr. Ball and to the group.
No, thank you so much, Dr. Ball. This is incredible information. The pediatric perspective on the COVID vaccine and on the infection itself is really fantastic. As a family physician, I don't take care of kids anymore as much as I used to. So this is so informative, not only for me, but the rest of our San Bernardino County health professionals who have joined us today. And then hearing about the 353 method on how to approach the conversation. That's always so important to have those conversations and to know how to have those conversations that are going to help us to continue to vaccinate our populations, especially here in the Inland Empire, where our rates are not as great as they could be. And so it's up to all of us to really work hard to make sure we have those conversations with our patients, with our friends, with our family, and give them an opportunity to tell us what they think about it, and then give them some space. And then when they're ready, to be able to come to us so we can be ready to give them the vaccines. So again, on behalf of the San Bernardino County Medical Society, I want to thank you so much for taking the time out of your busy schedule to join us and provide us all this helpful information.
Appreciate it. Thanks for having me.
Thank you so much. And just to let you all know, we have recorded this webinar and we'll be sending it out to all the attendees. So be on the lookout for that. And if any of you are interested in any upcoming webinars that the Medical Society is holding, we invite you to visit our website at www.sbcms.org/events. Until the next time, have a good afternoon.